In this video, I'm going to talk about the link between POTS, Ehlers-Danlos Syndrome, hypermobility type, and mast cell activation syndrome. So Ehlers-Danlos Syndrome, or EDS, is a condition that is characterized in its milder types by easy bruising and in its more serious types by more significant blood vessel abnormalities. There is also a subtype of Ehlers-Danlos syndrome called Ehlers-Danlos syndrome hypermobility type. And in this, there are three main components. There are hypermobile joints, there's tissue extensibility, so being able to kind of lift up your tissue or the skin and it would stay there, and tissue fragility. Within this hypermobile Ehlers-Danlos syndrome, there is a wide spectrum. Some people have no symptoms whatsoever, and others have a lot of joint pain, and it can involve just a few joints or many joints, and there is a spectrum in which people can lie. In addition, there's another condition called generalized joint hypermobility, and this can overlap with the hypermobile version of Ehlers-Danlos syndrome, and both of these conditions are diagnosed clinically. There is a higher incidence of both orthostatic intolerance and chronic fatigue syndrome in patients who suffer from Ehlers-Danlos syndrome hypermobile type and joint hypermobility syndrome. It is not fully understood why there is a link between them. It is postulated that because these conditions can affect connective tissue, that there can be laxity of the connective tissue in the blood vessels. So theoretically, when you stand up, if you already have lax blood vessels, they might fill more, so then you'd get that excessive pooling version of POTS. So that is one of the postulated mechanisms, but it hasn't been fully proven. So when it comes to the management of POTS, when you have hypermobile Ehlers-Danlos syndrome, there actually isn't a huge difference in the management, but there are just a few important things to point out and to be aware of. The first is the headache type. So if you get headaches that are exclusively present in the upright position and are relieved by lying down, and you have Ehlers-Danlos syndrome, then it might be worth considering the fact that you have a low pressure headache from a spontaneous spinal fluid leak. Again, it is very uncommon, but it is worth noting, and if your headache had those characteristics, then it might be worth considering. Having said that, migraine and tension type headache are still more common in everybody than this kind of low pressure headache, but it's just something that is worth knowing about. The second thing to note is in relation to the exercise. So in general, the exercise that is advised for POTS patients who don't have hypermobile joints is very similar to the exercise in those that do have hypermobile joints, but there is one caveat with that, and that is that there should be a greater focus on balance and proprioception exercises. So you will have seen in other videos that I spoke about what proprioception is, and it really is our ability to know where our joints and our limbs are without looking. And what is happening is that the proprioceptor nerves are sending signals up to the brain to let them know where your joints are and where your arms are, and if there's any abnormal positioning of your joints. Well, it has been demonstrated that patients who have hypermobile Ehlers-Danlos syndrome don't have as good proprioception as those that don't have it. So this just means that a focus on that in your exercise program is really important, and a simple way to focus on proprioception is through balance exercises, and you will see that I have loads of balance exercise videos on this channel already, so it would be worth including them in your exercise regimen. Also, if you did get joint pain from a particular type of exercise, it might be worth not doing that exercise or modifying it, or having a chat with your physiotherapist. The other condition that has a link with POTS is mast cell activation syndrome. So mast cells are everywhere in the body, and they are heavily involved in things like allergy, immunity, and inflammation. When you have mast cell activation syndrome, it implies that you either have an abnormal number of mast cells or an abnormal function of the mast cells that you have. So much like the Ehlers-Danlos Syndrome, the link between POTS and mast cell activation syndrome has not been fully defined. It is considered that it may relate to histamine because histamine is released by mast cells. So histamine could affect the autonomic nervous system in two ways. It could cause dilation of blood vessels, leading to, again, that excessive drop in the blood pressure or pooling in the blood vessels in the legs when you stand up, leading to that drop in blood pressure and the compensatory increase in the heart rate. But also histamine can have an effect on sympathetic nerves and increase the sympathetic activity. So the typical symptoms of a mast cell activation syndrome could be things like headaches, fatigue, brain fog. There can be abdominal symptoms like diarrhea, abdominal pain, bloating, and there can be skin flushing, skin rashes, that type of thing. So again, a lot of the symptoms are quite non-specific, which means that it can be quite difficult to diagnose, and that is further evidenced by the fact that there isn't any clear diagnostic test for a mast cell activation syndrome in this context. So there are some blood tests that can be checked largely in research laboratories, so they can check histamine levels and levels of other mediators such as prostaglandins, but none of these have made their way into clinical laboratory testing, and this is probably because in a lot of the research studies they don't necessarily correlate with the symptoms. So if you do have symptoms like some of the ones that I have described, and maybe a prominence of like abdominal symptoms like diarrhea, abdominal pain, bloating, or kind of flushing or skin rashes, and you feel like you may have a component of mast cell activation syndrome, the main way that we have to treat it at the moment is antihistamines. So you could give that a go if you wanted, obviously making sure that you can tolerate it and that maybe don't choose a sedating antihistamine for during the day.